here we injected the patient like Botox a few days ago, and lift your eyebrows up, and you can see there's kind of spot mainly on this side. So this is kind of I wouldn't say a problem, something expected. Sometimes it happens, and mainly because we're trying to avoid drooping the eyebrows. So the more we try to do that, the more chances of a Spock eyebrow, to happen. We have it both sides, mainly on the left side. So what I'm gonna do a little tiny injection here, 1 unit on this side, 2 units on this side. That will fix it. In 1 or 2 days, it will calm down or go down. I tell my patients, we can always, just in case if it doesn't go from the first injection, within 2 days we can also inject a little bit more, but this should be fine. If you have any questions, let me know.